So, before going to this presentation, I would like to thank the organizer of this conference for giving me an opportunity to present the topic on phytomedicine, the promising natural complementary approach towards the anti-addiction. So, let us see background of this presentation. Now, what is addiction? So, it is a chronic brain dysfunction which interferes with the parts of the brain which are responsible for the reward, motivation, learning, judgment, and memory. It is just like a hijacking of any person's mind and body, where a person could crave substances or different kind of behavior so strongly and become compelled to pursue those behaviors or substances even at expense of its well-being. And it is generally prevalent among the individuals of the modern society and whom they tries to pursue these rewards and relate to use of different substances and behavior of addictions. In this screen, you could see different types of behavioral addiction like codependency, food eating, gambling, sex, then addiction for internet and games, work, shopping, etc. And here you could see different kind of the substances abuse like alcohol, then opioids, then tobacco, inhalants, hallucinations, cocaine, heroin, etc. So this kind of different substances as well as behavioral addiction causes various adverse impacts on the health. Here, suppose substance addiction includes alcohol, drugs, and nicotine. Then alcohol could causes liver damages, then cardiovascular diseases, mental diseases, then various kind of the immune system weaken, then increase risk of the cancer. Various kind of the drug causes brain damages, heart problems, then overdose could lead to death also. The nicotine causes lung diseases, respiratory issues, lifelong health complications, heart attacks, etc. And here you could see different behavioral addiction. And these are different health impacts of these addictions. Like gambling causes financial ruin, then severe stresses, suicidal tendencies, etc. Then internet addiction may causes mental health disorders, social isolation, sleep disturbances. Shopping addiction could causes financial stresses, then relationship issues, anxiety, depression. Food addiction could causes obesity, diabetes, eating disorders, and various kind of the mental health issues. Over exercise or exercise addiction could causes the physical exhaustion as well as the injuries, malnutrition, hormonal imbalances. Then work related some addiction causes burnout, then chronic diseases, sleep disorders, and weak immune system. And finally, sex addiction could causes risk of various kind of the STDs. So in this slide, you could see the brain circuits associated with the addiction. This is the brain circuit. And this figure shows the comparison of the brain circuit in this normal type of brain and addicted type of brain. Here the green color indicates the reward protection and pleasure. Then this purple color indicates cognitive control. Then blue color indicates various kind of motivational drive. And the red color indicates learning and memory. Here you could see the disease model and the cycle of addiction. It includes binge intoxication, then withdrawal or negative effects, and the preoccupation or anticipation. At this stage, the person enjoys substances or behaviors. Then the brain engages its pleasure receptors and dopamine level get increased. And this resulted in feeling of the relaxation as well as intoxication. Then at this stage, when a person stops such substances or behaviors, the stress response kicks in and brain could respond in the form of anxiety or brain zaps. And finally, this one is the preoccupation or anticipation. As the person starts to become preoccupied by the idea of substances or different kind of behaviors for which he or she is addicted, the brain could carry on the executive functions and become compromised. And this causes brain to have difficulty regulating the actions, emotion, and the impulses. Generally, the addiction-induced short or long-term effects are executed by different processes, which involves neurotransmitters, neuronal protein, and gene expression changes, specifically in the neuron of the reward circuit. This one is the neuronal reward circuit. So globally, there are various kind of the anti-addiction treatments available, such as medicated assisted treatment, then cognitive behavioral therapy, detoxification, residential and inpatient rehabilitation, outpatient treatment program, 12-step programs, TCs, harm reduction strategies, relapses prevention program, and holistic approaches, which incorporates the alternative therapies like yoga, medication, acupuncture, etc. In spite of these all treatments available, there are various key challenges with respect to the anti-addiction treatment, such as psychological issues, co-occurring mental health disorders, inadequate support system, insufficient aftercare, then withdrawal and dependency, stigma and shame, inconsistent treatment protocol, financial barriers, lack of motivation, lifestyle and behavioral health. Then relapses triggers, neurobiological changes, limited knowledge and education, socioeconomic factors, stress and trauma, social environment, cognitive distortion, then genetic vulnerability and treatment limitations. Let us move towards phytomedicine. So what exactly phytomedicines are? So these are based on the scientific and medical evidences, which includes use of phytochemicals and plant-derived medications for the treatment, prevention, and management of such chronic brain dysfunction like addictions. It is generally proved that currently available synthetic drugs as well as conventional treatment could cause undesirable side effects, and sometimes they could found ineffective in various cases. So in this case, to overcome such limitations as well as challenges, phytomedicine has gaining worldwide attention as a promising, natural, cost-effective and safe complementary avenue with respect to anti-addiction. Here are some promising potential of phytomedicine. Like it is composed of pure natural compounds like phytochemical which are used in phytomedicine has therapeutic potential, and they could address various biological and psychological aspects of addiction. They could cause multi-target approaches as they can modulate the neurotransmitter level, reduce cravings, promote relaxation and management of the stress. Finally, holistic healing can be carried out by these phytomedicines. So in this regard, this phytomedicine could be used as a potential therapeutic strategy to cope up with the addiction without any side effect. So if we go with the phytomedicine, so what are the global opportunities with respect to this phytomedicine? Let's see one by one. So it could causes awareness for the natural and holistic health. It has global emphasis for the sustainable, eco-friendly and safe medical practices. It shows growing interest of the herbal medicines integrated with the modern medicine. Also, there is credibility due to the research and evidence-based practices, and the phytomedicine has potential for the personalized medicinal treatment. They have potential for the development of nutraceuticals and functional foods. There is also global acceptance after this COVID with respect to this traditional medicine for the revival and the integration into the healthcare system. Then there is increasing demand with respect to educational and professional prospects. And finally, various type of the economic opportunities. So let us see how phytomedicine could be the complementary strategy to cope with addiction. These phytomedicine are generally produced by using various kind of the phytochemical having strong antioxidant potential. So these phytochemicals have specific role in this phytomedicine, just like reduction of cravings, then withdrawal symptoms management, neuroprotection. It could support for mental health, then minimizes depressive symptoms. They carry on detoxification as well as anti-inflammatory effects and appetite control. This phytoadaptogen also kind of a natural substances which are integral to the phytomedicine, and they could show the ability to modulate the stress and enhances overall well-being. They also have some various important roles or some mechanisms, just like normalization of the neurotransmitter level, which causes managing the cravings by stabilizing dopamine, reducing the mood swings, etc. Then inhibition of the cortisol-induced neuroinflammation and reduces stress, anxiety, which can trigger the addictive behaviors. They also causes upregulation of the neuropeptide Y, which could help to manage the emotions, triggers for the addiction and reduces the withdrawal of the stresses. It also play important role with respect to reducing anxiety and stress response, increasing mental exercise capacity. It could improve the quality of mental work and regulates the emotional responses. So there are various complementary role of phytomedicine in the conventional anti-addiction treatment. That's why we could go with this complementary medicine. These aspects include some synergistic effect, that is, they enhances the efficacy of the conventional medication, improving overall therapeutic outcomes. They could minimize the adverse effect associated with the synthetic drugs, promoting the adherence to the treatment regimes. Also, this phytomedicine, when taken with along with this conventional addiction, anti-addiction treatment, could addresses the psychological aspect of addiction, helping to stabilize the mood and reduce the anxiety. They could alleviate the withdrawal symptoms, making the recovery process more manageable. They also enhances the memory and learning, supporting the uptake of the new coping strategies. They could help to regulate the body's response to stress through the adaptogenic properties, reducing relapses triggers. They could also carry on neuroprotection, also helps to improve the quality of life. Then cultural relevance, as it offers culturally accepted options, increasing engagement and adherence to the treatment among the diverse population. And then they could provide the lower cost options that are more accessible, making treatment more feasible and individuals with the limited resources. Now, this table could show the phytomedicine which are used for reducing the cravings of the addictive substance. This phytomedicine includes some kind of the phytochemicals, then some herbal medicines like rosamin and salidroside, then N-acetylcysteine, then ginsenosides, kudzu, saffron, omega-3 fatty acid, curcumin, etc. And here you could see their different kind of respective roles. Here Here, the kakakoa, then the valerian root, chamomile, passion flower, lemon balm, then peppermint, ginger, amino acid. This kind of the plants or phytomedicine could be used for management of the addiction. Then curcuma longa, resveratrol, flavonoids, EGCG, such kind of the secondary metabolites, along with omega-3 fatty acid, G. biloba, then W. somnifera, that is ashwagandha plant, B. monifera, then theoline, they all act as a neuroprotective agent. These are the list of phytomedicine which could be effective in management of the mental health, like St. John's wort, then kava, then lavender, ashwagandha, that is W. somnifera, then passiflora, then R. rosea, L-theanine, then valerian root, and omega-3 fatty acid. And these are the list of some phytomedicine which could act as a detoxifying agent. That is Silonga, Milthisel, then the Chlorella and Spirulina, then Pihas, etc. Here are their detailed description of the roles with respect to this anti-addiction. Then the EGCG, fenugreek, capsaicin, konjac plant, dark chocolate. These plants or this phytomedicine could act as a regulator for the cravings. So let us see some plants which have specific phytomedicinal role in anti-addiction. So this one is the kudzu plant, that is Pilobata. Here you could see the bunch of flowers. These are the pods and these are its roots. So they have various significant roles with respect to anti-addiction and specifically in the reducing the alcohol consumption. So they could carry out slowing alcohol metabolism and modulates the neurotransmitter, thereby helps to reduce the cravings and desire of alcohol consumption. Next one, they could modulate the dopamine in the brain, which decreases and rewards sensation from the alcohol consumption. And then they could increase the serotonin level to help and alleviate the mood disturbances and reduces the anxiety, making the individual less likely to turn into the alcohol addiction. Its active compound includes some alkaloids like isoflavonones, etc. Here you could see the mechanism of this pilobata, reducing the alcohol consumption. With respect to this mechanism, it carry on different role like inhibition of ADH, then modulation of the dopaminergic system, enhancement of the serotonergic activity, reduction in the alcohol absorption, etc. This one is one of the important plant which is used in the psychology as well as for the anti-addiction. This one is the Passiflora incarnata for reducing the anxiety and insomnia withdrawal. So this plant or flower of this plant could calm the nervous system. They could reduce the anxiety and insomnia. They improve the sleep quality as well as balances the neurotransmitter. And the important active compounds or bioactive compounds or the phytochemicals included in these plants are flavonoids, then alkaloids and the GABAergic compounds. And this one is their mechanism of action. They could carry out the modulation of the GABAergic system, then sedative and anxiolytic effects, the mild MO inhibition, then antioxidant and anti-inflammatory effects can be carried out by this flower. Now next one is the kratom. This plant could be used for managing the opioid withdrawal. It reduces the muscle aches, gastrointestinal distress and sweating. It alleviates the anxiety, restlessness and depression. Partial opioid receptor agonism also helps to control the craving for the opioid, and it boosts the energy and motivation. It also includes some active compound in form of the alkaloids. Here we could see the mechanism of their actions. Now next one is the C. guinesis. It helps to reduce the alcohol consumption also. So by modulating the neurotransmitter like GABA, it reduces the urge to consume the alcohols. Here you could see the overall tree. Then this one is the flowers, and these are the seeds, and this is its fruit. And all these parts could be used for this preparation of phytomedicine. Then it also play important role, which is protective effect on the brain. Then it causes stress and anxiety reduction by calming effect of the flavonoid. It reduces stress and anxiety and common triggers for the alcohol consumption. And it also has some bioactive compounds like phytochemical, including flavonoids, triterpenoids, sterols, etc. And this one is the mechanism of action. So they carry out modulation of the GABAergic system, then antioxidant properties, which could reduce the oxidative stress caused by the alcohol, protecting the region of the brain related to the addiction and reducing the alcohol dependence. And then also they could play important role with respect to anti-inflammatory. Like they could lower the neuroinflammation, which can contribute to the addiction-related behaviors and alcohol or any kind of substance cravings. The next plant is CBD, that is cannabinol plant, and its important component is this CBD, that is cannabinol. So it causes the decrease in cravings, reduces the withdrawal symptoms, then it improves the impulses control and promote the brain health. Here you could see the diagram showing the mechanism of the CBD in reducing the addictive behaviors associated with the various substances. Here, the different steps which are included in this mechanism are modulation of the ECS, then reduction of the anxiety and stresses, then modulation of the glutamate and dopamine system, and anti-inflammatory and neuroprotective effect. As the CBD reduces the neuroinflammation, which may contribute to the long-term change in the brain associated with addiction. Here you could see the Arrosia plant. These are the bark of this plant, these are the flowers, and this one is the powder of this bark. So this plant also has important role for reducing the stresses. Just like by reducing the cortisol and promoting the mental resilience, this plant could reduce the stress, which could trigger the addictive behavior. Then it improves the mood and cognitive function. Further, the antioxidant property of this plant could protect against the damage, which could result into the chronic stresses or substance abuse. And the important phytochemicals or phytoactive compounds are the rosavin and celitroside. Here you could see the anti-addiction mechanism of this Araucaria plant or flower. So this mechanism includes various roles like adaptogenic properties and regulation of cortisol level, as it reduces the release of cortisol, which can be elevated during the stressful events and addiction. Further, it enhances the serotonin and dopamine level and improves the mood, motivation, and reward response, and helps to reduce the stress-related cravings and addictive behaviors. Next one, the antioxidant and anti-inflammatory effect also helps to support the reduction in the stresses. And this one is the important plant of Ayurveda, which is called as the Ashwagandha also. So it is mainly used to manage the stress, anxiety, and support in the anti-addiction. So by balancing the cortisol and neurotransmitter, this plant could help to manage the anxiety and stresses, which could often lead to the relapses. Then its neuroprotective effect could support the brain's health and help individual to recover from the brain damage associated with the addiction. And also it could enhances the mood and cognitive functions and improves the emotional well-being during the throughout the recovery process. And its phytochemicals or the active substances include alkaloids and vitaminoids, etc. So this slide shows mechanism of this plant in managing the stress, anxiety, and supporting in the addiction recovery. This plant could also help the body to cope with the stress by regulating the HPA, also reduces the cortisol level. Then it could modulate the neurotransmitter like GABA, serotonin, and dopamine, and reduces the anxiety and depressive symptoms, which are always linked with the addiction. It could also promote the neurogenesis and reduces the oxidative stress and the combats inflammation in the brain, which could support the recovery from the addiction-related damages. And then also it could balances the immune function and reduces the stress-induced immunosuppressions and promoting the overall resilience during the addiction recovery. The next plant is the bee mooney. So it improves learning, retention, and mental clarity by supporting the neurotransmitter function. Then it could protect the brain cell from the stress and aging and ensures long-term cognitive health. And it could regulate the cortisol and promotes the neuroplasticity. It could help the brain to cope with the stress, anxiety, and fostering its well-being. The important bioactive compounds are flavonoids, then saponin, alkaloids, then the bacoside A and B. Here is the diagram showing the mechanism of this plant for promoting the overall well-being. So this plant could boost memory and cognitive function by increasing the brain level. Then it acts as a neuroprotective agent by reducing oxidative stress. It reduces the cortisol level and modulates the HPA axis to manage the stress, and it stimulates the neurogenesis and increases brain-derived neurotrophic factors. Now, next plant is also one of the important plant, that is the biloba. So, this plant helps to aid with the cognitive neuroprotection, reduces addiction, craving, etc. Here, it could regulate the dopamine level. By modulating dopamine level, it helps to reduce cravings and withdrawal of the symptoms associated with the addiction. It could also improve mood and reduces the stress, which are key trigger for the addictive behaviors. And it also improves the cognitive control. This plant contains some bioactive compounds like flavonoids, terpenoids, etc. Here is the diagram showing its mechanism. So this plant enhances blood circulation in the brain and improves oxygen and nutrient delivery. It also plays important role as an antioxidant and reduces the oxidative stress and protects the neuron from the free radical damages. Then it regulates the level of the dopamine, serotonin, and the norepinephrine, and improves the cognitive functions, mood, and reducing the stresses. So this is the table showing role and mechanism of the N. rustica over the commercial tobacco. So this plant could act as an alternative for the tobacco. Let us see its different kind of important roles one by one. So first one is it offers potential alternative for reducing the nicotine consumption. It may serve as a transitional product for the smokers. It contains other beneficial bioactive compounds having antioxidant activity. It could retain the sensory aspect of the smoking. It could offer the protective effect against the oxidative stresses. It could lower the exposure to the harmful chemical, and it may provide the psychological comfort for users also. Next plant is the curcuma longa. It could act as an influencer for addiction related behaviors. It plays a few important roles like reducing inflammation linked to the addiction. It protects against the oxidative stress, supports the brain health and the function. Then it could influence the dopamine and serotonin level. It may aid in managing withdrawal symptoms. It reduces the stress related various kind of behaviors also. Although these phytomedicine are very good as a complementary agent, but there are few precautions also with respect to integrating this phytomedicine into conventional treatment. Let us see these precautions. Okay. So first one is always consult with the healthcare professional before starting this phytomedicine to avoid any potential interaction with these medicines. Then ensure the quality and sources of the products from which you are taking this phytomedicine. Then awareness for the potential allergies should be there. Then consult with respect to dose administration, because follow recommended doses and the administration guidelines to prevent any kind of adverse effect and ensuring the safety of that patient. Then recognize that individual may respond differently to different kind of the phytomedicines. Therefore, there is requirement for the personalized treatment with respect to this complementary therapy. Also, you should monitor any kind of the side effect or adverse reaction, especially when combining the phytomedicine with the conventional treatment. Also, avoid the over reliance. Then interference with the conventional medication should also taken care. Then research evidences should be carried out. So use of phytomedicine that have been supported or reported by the clinical research should also used in this phytomedicine treatment. And finally, pregnant or nursing individuals should avoid certain phytomedications as their effects on the infant also. Just I have said that some human clinical trials or any pharmacological studies should be carried out or should be referred before taking phytomedicine as a complementary therapy. So we have carried out some referencing and some kind of the evidences right from 1958 up to 2024. So here we could see some human clinical studies with respect to this different kind of medicines, and these are the consecutive years, and here are the outcomes, and these are the focus of studies. So this one is from just a minute, this one is from 1958 to 1987. These are some specific plants only. Then these are 1998 up to 2008, and this data is from 2010 up to 2024. So all over world, different kind of phytomedicines or phytochemicals or some phytoadjuncts also used as a phytomedicines and complementary therapy. So we can conclude that due to the stress calming and anxiolytic, neuroprotective, anti-inflammatory and antioxidant properties, phytomedicine could exhibit capacity to manage the withdrawal symptoms like anxiety, stress, depression, and mental health problems, along with the detoxification. They could also play important role in reducing the addiction or substance abuse by reducing cravings for the addictive substances or behaviors if used as a complementary medicine. In upcoming era, existing treatments different kind of means conventional treatments related to the anti-addiction potential of phytomedicine could be endured as a promising active research area. We are further efforts into phytomedicine research involving optimizing the dosage and the target of promising phytochemicals are recommended for their beneficial effect as an anti-addictive. Then personal and nutraceutical produced by using such kind of phytochemical based phytomedicine could be used or serve as a functional supplement or nutraceutical supplements for managing the mental health against addiction. Also, the regular intake of different kind of dietary fruits, vegetables, herbs, including such phytochemical rich precision diet will promisingly support to control the addiction. So, in this context, such phytochemical based natural, safe, and affordable phytomedicines could be efficiently used as a complementary treatment to cope with the addiction. Here are some key references. Thank you very much.